The views expressed in this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome everyone. Thank you so much for joining us for another edition of Insights. I'm Bethany Ricciardi here at Mid-Michigan Medical Center Alpena. I'm joined with President Carmen Biella and Chief Nursing Officer Chuck Sherwin. Thank you so much for being here, gentlemen.
You're welcome.
Thank you. So can we talk a little bit about this new partnership? It's been about 4 months since we've joined Mid-Michigan Medical Center, and what's some of the history? I mean, what was some of the things that you learned before making this partnership?
Well, it's kind of interesting because our organization is about as old as Mid-Michigan Health when they first started in Midland, and so we're over 70 years old, both organizations. We will be the second largest organization in Mid-Michigan Health, and so we make the 5th hospital that Mid-Michigan Health has in their system.
So I know there was some, hesitation. There was a lot of conversation that happened before you guys made this decision. But how has it been a benefit to Alpena to make this change?
Well, I think some of the things that we were most desirous of finding were the benefits to our patients. And now that we're in Mid-Michigan for at least a few months, we've already seen benefits coming from the relationship between Mid-Michigan and the University of Michigan. There are quality initiatives that both organizations work together on. And then I think one of the bigger benefits as it evolves or develops will be the clinically integrated network. Having our patients be able to move wherever they want to within the system. And then of course it's always the patient's right to choose. They can go anywhere they want. But within the system of Alpena, Mid-Michigan, and the University of Michigan, it'll be very seamless.
And that was one of the biggest goals. I remember it came up over and over again at meetings and things like that. This was for the patients, for the healthcare, for the patients, right?
I think clearly it has to be remembered, and I think we need to be graded on how much we do benefit the patients. And I think you'd probably look in 2 different areas. Quality and scope of services would be the first one, and probably the second one would be expense reduction. We're doing some purchasing now. We're getting a SPECT CT, and we'll probably save somewhere in the neighborhood of $150,000 on that purchase just because we're in a system. We have to replace our linear accelerator from our cancer center. And there we'll probably save right about $500,000 just by being able to purchase with the power of Mid-Michigan and the university.
Are there any other resources or connections that joining with this entity has brought to you folks recently? Any programs or, just goals in that aspect?
I would probably look to Chuck to talk a little bit about the benefits of merging different departments and improving services in different clinical areas.
Yeah, one of the things that we talk about is having the bench strength that Mid-Michigan and the University of Michigan offers. And so over this next year, both organizations are looking at all of their policies, both operational and clinical, deciding which is the best policy from the patient's perspective, and then we'll be implementing those policies. And again, like Carmen said, that seamless transition. So not only will our organizations look and feel similar over time, but how we treat the patients will be similar as well. And then being able to access the University of Michigan from their research base and their clinical innovations that they've done is just extremely helpful. And now it's just kind of a phone call away. Before, we just didn't have that access like we do today.
So how has, continue.
A lot has been said about the electronic health record in healthcare today. And I think one of the things that we saw in Mid-Michigan early as we looked at the different systems we might join was that Mid-Michigan was already committed to the software EPIC, E-P-I-C. EPIC is probably the premier software for healthcare in the nation. And although Mid-Michigan was already committed to it, they were able to bring us in right away as soon as we made the commitment back in April. So being able to access patient records all the way up and down the system, from the doctor's office to the University of Michigan, if the patient ends up there, is really beneficial to the patient.
So how has the whole transformation really been going? Is it smooth? Have you been able to hear reactions from employees and patients?
We were actually a little bit surprised how prepared Mid-Michigan was. As soon as we were able to make the commitment, Mid-Michigan put together a system of committees that looks at every area of our healthcare system and how to integrate it. I think we have something like 20 different committees, everything from policies and procedures to legal issues to contracts, everything. And so we have all of that work spread out among Mid-Michigan staff and Alpena staff. It's really going very well.
So, did you
I just think we were really impressed with the willingness and openness of Mid-Michigan to try to push us and us push them to get this done in a systematic and seamless way. There's been, if you look throughout the nation, a lot of organizations that have tried to come together that have failed. And a big piece of that is being able to communicate effectively and work together to get to that common goal. And our expectations is within a year of April that we would be pretty well integrated within the system.
And that seems like a big benefit as well. A lot of Mid-Michigan employees and administration being on campus. You know, I've met the CEO a couple of times. She seems great, very hands-on it seems.
Yeah, Diane Posler-Slattery, as the CEO, really emphasizes coming together. Her efforts have been to really make sure that the people come together and work on merging departments, services, and all kinds of things, from policies right down to patient care. It's been a very good first few months.
And it seems like it must just be a benefit for Alpena and Mid-Michigan to have this partnership, not so much one or the other.
That, again, is one of the things that the board had to sort out when the system was chosen. One of the bigger reasons that the Alpena board chose Mid-Michigan and the university is that they do have a culture much the same as ours, in that it's focused on the patient first, and it's also built around people.
Is there anything else that you want to mention about leadership changes?
I just think that, you know, of the 5 pillars, 3 of them are related to engaging patients, employees, and the medical providers. And so there's a big focus on that, and our cultures are very similar that way. I think that Mid-Michigan has been impressed of our willingness to push to be into the system and integrated. I think many times when a system comes in, we go on and keep doing it our own way. And Carmen has really pushed us to say, if we're going to be a system, then we have to act and think like a system. And so he's been pushing us pretty hard to say, what can we do to make sure that we're integrated well? So as a patient comes into Alpena, they'd have the exact same experience in Midland and or the University of Michigan.
Awesome. Well, thank you so much, both of you, for being here today.
Thanks.
Thank you. And don't go anywhere, because we'll be right back. Welcome back, everyone. Thank you so much for joining us. We're still here at Mid-Michigan Medical Center Alpena, but I'm now joined with Dr. Richard Bates. Thank you so much for being here.
You're welcome.
So we keep hearing we're stronger together. How do you see that being effective in the healthcare side?
I think the biggest thing is we are developing relationships with other providers, physicians, systems of care that is allowing us to align our practice, our patterns, our protocols, process, all of those sorts of things that align with our partners in Midland and in Ann Arbor. And so that sharing of information is wide open, and that's pretty exciting.
So are there any super big changes that patients should expect to see in their care?
Not right now, because I think the care that's been provided here has been excellent. And so we're really just taking that level of care and that expertise up a level and seeing what we can do better, what we learn, what we can do better to improve the care. I think the biggest thing that we're going to see is that cutting-edge technology and information transmitted all the way back up here to Alpena.
Are there any specific health programs or departments in general that you're hoping to see grow in this transition?
I think the biggest one that we're starting with right out of the gate is with primary care, family medicine, internal medicine. And so probably the biggest thing from the physician practice standpoint has been the acquisition of the Medical Arts Clinic, which will be a Mid-Michigan family medicine clinic. And that's really going to be, you kind of have to start there with that primary care base to strengthen it, to build it up, to recruit physicians into that clinic from the Mid-Michigan Health System and elsewhere, to use that as sort of that base for physician training. So one of the key parts of our recruitment effort is training residents and medical students in family medicine and get them acclimated or get them just to see the community and say, boy, when I get done with my training, this would be a great place to come back to just because of the relationships they've made. And so getting that medical arts, now Mid-Michigan family medicine off the ground and shoring up really that base, that's really been our focus to start with. And then starting to explore other specialty areas, specialty services that we can facilitate either visiting clinics, specialty clinics, and or telemedicine.
And with this partnership, we've even seen some new doctors here, right? Can you speak on how many are from Mid-Michigan and maybe what experiences they're bringing to Alpena?
So some are right from the start. Some of the physicians who've helped us out were in the emergency room. So covering some of the emergency room shifts, we've had Mid-Michigan doctors come up and do that. We've recruiting and have recruited some new doctors. We have a new orthopedic specialist who started this past week, Dr. Belting. We have a pediatrician who is starting this week, I guess, Dr. Amin. We have a dermatologist who's starting in 2 weeks, Dr. Diskin, and we've also added a physiatrist, Dr. Meyer, in the last couple months, and we have a nurse practitioner that's starting in our wound clinic. So lots of things going on. We're finding, I think, that this affiliation with Mid-Michigan will have physicians and providers give us a second look because of just that excitement to be part of something that's going on and have that affiliation all across the line. So
from doctor to doctor, how is it working with these new people?
Oh, I think it's exciting. I think everybody wants to be on a team that's winning, that is doing great stuff and is succeeding and has the resources to learn and get better and provide the best care. And so that's something fun to be part of.
So I know since the partnership as well, you've been able to bring some departments back onto campus. How has that been a benefit for the healthcare?
Well, I think our most recent especially we've added to campus was pediatrics, and that is part of our long-term plan. What services function best on site because they provide a service not just community-based but also hospital-based. So pediatrics who cover inpatient admissions but also newborn deliveries, that makes a lot of sense. And so we continually look at those options and what's best where. Medicine's changing all the time, and what services are best provided as an outpatient. A lot of medical care is shifting to outpatient care. How do we adjust and do that as well with the changing landscape?
What would you say has been one of the biggest challenges for physician care since this new partnership?
Well, I think the biggest thing is we are affiliating all of and centralizing all of how we credential and privilege physicians. And so how a physician is credentialed and privileged still is approved by our local board and our local medical staff. But all of the criteria for that credentialing, checking the medical school, checking their training, checking all the different aspects of someone's licensure essentially, is undergoing a change to be centralized so that the physicians here are credentialed and privileged just like the physicians in Midland or the university. And so that really ramps up our attentiveness to even more detail and just changing some of those process measures along the way it's much more rigorous, and that's a great thing. That's not a bad thing. It's something that we will adapt to and change to, and we'll get there.
Right. So it's only been a short 4 months, but can you talk a little bit about maybe one of the biggest achievements you've seen in care?
Well, I think the biggest achievement to date is the addition of the Medical Arts Clinic to our hospital system. I think that the mentality, I think the biggest thing that is for us, from either a physician making referrals or just starting to build relationships, whether it be with our counterparts in Midland or one of the other subsidiaries, but really is also having that relationship with the department chairs and professors and individuals at the University of Michigan, so that when we make a referral, have a question, it's a quick phone call. The university has a just say yes mantra for appropriate transfers. So we call up the people that we have at the university if we have to make a transfer, and they're going to accept those patients just as if they were in the system or in their own hospital. And so that transition of patients back and forth is really the most exciting thing for all of us.
Great. Is there anything else about care transitions for patients that you'd like to mention?
I think that's only going to get better. The University of Michigan has an electronic health record called EPIC. Michigan is transitioning to that health record in April of next year, and then we'll follow in October of next year. And so what that will be is not only is a phone call relationship, but now after October, all of a patient's medical record will be seamless throughout the whole health system. So if a patient is seen in Ann Arbor, their physician here in Alpena can read that chart at the same time. And so not waiting on reports and callbacks and all that kind of thing. And so the physicians in Ann Arbor or Midland have the same access to our charts and patients as well. So that's really that seamless sharing of information to provide the best care for our patients.
Awesome. Well, thank you, Dr. Bates, and thank you so much for being here.
All right, thank you.
Appreciate it.
Yes.
And don't go anywhere, because when we return, we'll be back with more on the Mid-Michigan Medical Center Alpena partnership. Welcome back, everyone. I'm here in the Health Resource Center with Manager of Organizational Development, Robin Benson. Thank you so much for joining us. Sure. So can you tell me a little bit about what your first reaction was when you found out that you would be partnering with Mid-Michigan Medical Center? I know it was a lengthy transition to finally get there, but what were some of your thoughts?
I think we all knew that there were 4 potential partners, but didn't know who those 4 potential partners were. And I think that, and I think I've heard that across employee groups, that when we heard it was Mid-Michigan Health, that there was almost a sense of security in that in that brand and that recognition that we had already had University of Michigan affiliated with our cancer center, and so I think it was a known entity, and I think that has helped ease employees' concerns, and I think everyone just kind of went and
relief.
Yeah. So I think they're across the board. Most, if not all, of the comments I've heard is that they were very grateful that that was the choice, and all felt that we could back that choice.
So I know you don't work with patients. What is it really that your department focuses on?
Organizational development works with education within the organization for employees. So we oversee clinical education, orientation, leadership education, those sorts of things, annual competencies, making sure we meet requirements as far as education, along with some other things, but education is our focus, as you can tell.
So how did you educate and kind of help prepare for this transition?
Sure. Well, knowing we had a transition coming before we even knew who that was, we decided that we wanted to equip leaders and managers, supervisors, with some change management support so that they could help their employees, so that knowing that everybody deals with change differently, some better, some not so well, how do we equip our leaders to help employees get through change in the most effective way possible? And so we did some change management workshops in small groups with leaders to help them understand what does change theory look like, of those models, and what is the normal course of action throughout change that people might take emotionally and with their work, and just supporting those that might resist change to help get us all through that. And it was good. We had some good discussions, and I think leaders felt a little more equipped to help both themselves and their employees through change. So,
Were there any specific orientation process that employees were required to go through in this transition? Anything specific?
Sure. Yep. After the announcement that Mid-Michigan would be our coming on board with us, that we had some orientations with them. They came up. There was a group from Midland in the education department there that came up, and also my staff helped put them through an orientation. What does it look like to be a part of Mid-Michigan Health overall, and what does that mean for you as an employee? And so those sessions, I think they ran about an hour. We had multiple sessions over at Alpena Community College in the big theater, and employees got a chance to understand what the health system looks like, what other subsidiaries were in the health system, what other entities and groups, and to find out what the vision was, what the mission was, what the values were. I think they found more similarities than not, and had a chance to ask questions and understand the culture and to know where we're headed. So I think they walked away. I know I did. I got to help teach it, but I also walked away from those employee groups feeling more comfortable that people didn't think that there was just going to be some one day the old and the next day all new, and that it would be a gradual change, looking with what different things would happen with the integration teams, and those are still ongoing. So small, intentional, meaningful change over the course of time, and that's what's happening.
So have you been able to really see employees' reactions, maybe from the beginning to, I know it's only been about 4 months since this ongoing transition's happening, but maybe some of the differences? You mentioned they feel a little bit more comfortable. How are their reactions been?
Well, I think that employees feel the safety in a system. And so, we were doing well before as a hospital. We certainly were not in need of saving, but to have a system come on board with a known sense of quality, and that I've heard a lot of positive comments. I think they like some of the small changes going on as far as just little things that they're seeing that will help support them. I know in my world it's education and different programs we're bringing. We did, a great job before, but as we have partners, we both are looking at each other and saying, what are the great things you did and what are the great things we're doing, and how can we merge those? So in a lot of interaction with groups, because now we have more people to reach out to and more partners to discuss things with, and how we can take the best of both worlds and really become better overall.
Are there any internal changes that you could specifically touch on that have happened for staff?
We are making changes to our general orientation for new employees so that we're consistent across the system. Traditionally with Mid-Michigan Health, all employees came to Midland, but of course it would be, we can't really send every new employee down to Midland, so we'll be mimicking their new orientation. Very similar, but that way everyone's consistent. And then there'll be some changes to nursing orientation. One thing I found in observing their nursing orientation is that it's just a little bit more hands-on, and so we'll be incorporating that change, and we'll be implementing some leadership courses in the near future called MyLead. And I think Mid-Michigan Health themselves have just started doing that this year, but those courses are meant to support leaders in helping to support their staff, and support leaders in a new role as a leader, so that they feel comfortable in a new role as a leader and knowing where to reach out for help and helping their employees, because it's overwhelming, especially if you're a new leader. So those courses will be coming soon, probably by the fall, and I've been to them down in Midland, and they're very helpful, and there's very much a culture of support within not just their educational team, but what I've seen within different employees at the system. So it's been good. It's been good.
Good. So it seems like it's kind of like a whole new family. So how does it feel to kind of be a part of a bigger picture like Mid-Michigan Health?
It's very good. Like I said, we have many more partners to reach out to. We have additional resources, not only with Mid-Michigan Health, but at the University of Michigan. And we have things to share with the system and that they want to look at as far as what is Alpena doing. And so I think, like I said, overall, we'll get the best of both worlds, and we'll both get better from this partnership, both in our educational department for our staff and supporting them, and just as a system overall.
Awesome. Any specific goals or hopes for the future that you want to mention?
Just to hopefully, as far as my department, that would be to make sure that we're giving top-notch support to employees and to supervisors. Throughout change, things can get overwhelming sometimes, and so we definitely, it's all good changes, but still change can wear on you. We want to make sure that we can get through some major transitions as they occur, and make sure our managers feel comfortable in that because they're supported well. So give them those tools that they need.
Awesome. Well, thank you so much for being with us, Robin.
Thank you.
Appreciate it. And thank you so much for joining us, and be sure to tune in next week for another edition of Insights.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.